All right, everyone, welcome back to Stage Free, where we help educate and empower patients to give you, the caregiver, the patient, the provider, the tools you need to master survival. I am your host, Loriana Aldama. I'm a journalist, I'm a two-time cancer survivor, and I really want to help empower you. And so today, we are diving into a deeply personal and powerful conversation about survivorship, the phase after cancer that we know is so often overlooked when people say, oh, just forget you had cancer. So our guest today is Dr. Kate Rosenblum. She is a psychologist, a therapist, professor as well, specializing in trauma. But what makes her so special and why I'm so excited to have you here, Dr. Kate, it's not just your professional expertise, but that you have walked this journey. You understand the emotional toll. You've been really on both sides of understanding the mental side, but you also going through this yourself. So thank you for being here with us and to share your story, your challenges, and really strategies to help everyone cope and some actionable advice. So thank you again for joining us. Let me say this cautiously. What I love about your story, not that you had to ever go through this, is that you've dedicated your life to helping others navigate trauma. But when you were diagnosed with triple negative breast cancer, you found yourself in unfamiliar territory.
Absolutely. Well, first of all, thank you, Loriana, for having me here. And thank you for the incredible work that you do because it is so important. And I really leaned on programs like this, to really hear from other survivors about how they were navigating this journey because you are absolutely right. There is literally nothing that prepares you for a moment when someone says to you, you have breast cancer. And so, with all the expertise in the world, I was just as blown away, humbled, scared, unsure, kind of desperate, really. Right. And when I heard those words and entered into this journey, and as I've moved through, and I feel, incredibly lucky to be here today to share my story with you. And at the same time, deeply appreciative of the way that this journey is just incredibly traumatic and, leaves a mark. So I'm delighted to be here. Thank you.
And and I'm sure, not that this is not how you wanted to make yourself better at your job, but you know, it surely gives you a new lens to which you see things because you've walked this path. What I also love sharing about your story is that everybody needs help getting through these journeys. For someone to say, "Oh, I'm fine," because they feel some sort of shame. You specialize in trauma and you needed help, and
Yes,
it's okay.
absolutely. It is absolutely okay. It's necessary. Those of us who have faced, this illness that, have sort of walked this walk, we know that it is profoundly life altering, and so yeah, I have expertise and I think that helped me. I think there were ways that I could say, this is trauma. Like this is really traumatic. And my journey was tough, I think it was traumatic, but also like to really realize like just because you know something doesn't give you a shortcut or a pass through it. Like, I'm a human. This was hard.
Right. So, and I want to get into your story and have you break down your diagnosis. And on that note, get to the fact, like I have a lot of people call me who are gone through cancer or going through cancer. And I know when I get that call and they say, do you have like 10 minutes tomorrow? I'm like, they've been diagnosed or someone they love. And the last call I got was somebody crying, saying that their husband told them they should just get over it. And I'm like, please put me on the phone with him. But before we get to that, so we're going to table that whole conversation of how frustrated it is when I hear that. I'm sure when you hear that, you don't just get over it when you live with the repercussions of it every day. So let's start with your story. And when you were diagnosed, this was not the first time you had been part of a breast cancer journey.
Yeah, thank you for acknowledging that. So, my journey with triple negative breast cancer really began when my wife was diagnosed, 10 years prior to when I was diagnosed. And, at that time, we were shocked. We had no idea that this was even possible. And, here I was, the parent of two young kids, and really just thrown into this world of being a caregiver. and watching my partner go through, a course of treatment that I really knew nothing about. And so there were such a mix of feelings that came along with that experience, including, incredible fear and worry, but also an incredible responsibility for sort of holding everything up while,
Right.
she did what she needed to do to survive. Um, and so going through that journey, I think, we were lucky. We have, we're very strong together and we emerged together. But, it was also sometimes lonely, I think, for her, to be the one who was going through the illness and the treatment. And for me to be sort of like, I'm trying to hold all of this up and I really don't understand all of the things that, she's going through and all the things I'm going through. So fast forward 10 years, later, I'm sitting in a radiology office, getting my mammogram and they're calling me back. And I'm thinking, why are they calling me back so many times? And, when they sort of said finally, like, this is why we've been calling you back so many times. We really think this is cancer. I remember saying to him, that's not possible.
You're
I
like, no, I'm invincible, and I've already been through this one time
already
as a
did.
caregiver.
Right. I learned really quickly that the thing about odds and, likely is when it's comes down to you as a person, it's really a 0-1 sort of thing. So yes or no, you have it or you don't have it, right? Like
I
that.
know, and you're a doctor, and you say you even hate hearing odds as a patient or giving them to patients because I can't stand saying, well, okay, if it's 1 in 1 million, why am I sitting here? If it's one, like,
Exactly.
I'll let you get back to your story, how you were diagnosed. And so, from what I understand, you were called back several times, and you're a doctor, and you're like, something's not right.
hmm I knew something wasn't right because, just the expressions on people's faces. And then when the doctor was going to talk with me, they said, here's a nurse and she's just going to be with you to sort of hear what the doctor. I thought, oh man, I have cancer. It really blew me away. And, to then go through the biopsy and learn that I had triple negative disease was really scary because I understood what that meant. Now, my partner actually caught it much earlier than I did. And so hers was still stage 1. And it was incredibly stressful and traumatic for her to go through a lumpectomy and chemo and radiation. Um, but because mine had regionally advanced, was in the lymph nodes, and it was larger at the time that I found it, and treatment had changed. When I sat down with the oncologist and she mapped out what treatment was going to be, it was an 18-month course of, neoadjuvant chemotherapy,
Explain what
surgery.
that is to everybody.
Yeah, that's getting chemotherapy before they do the surgery so they can see how the tumor responds to that. And also so you can just get started right away. And so with triple negative disease, what that means is that they don't actually know what those how to target the specific characteristics of your cancer. So some cancers are estrogen responsive and
That's
they're
on my.
specific. That was yours? Yeah. So they have some, treatments that are targeted directly to that. Or HER2, they have treatments that are directly targeted. But with triple negative, it means that the 3 things that they know how to target are all negative. And so basically what they do right now I'm not an oncologist, I'm a doctor, but a different kind. So the way I think about it is they just throw everything, the kitchen sink approach, right? So I had 4 chemotherapies before surgery, AC and Taxol and carboplatin. Um,
And, and,
and also, huh?
and with with the chemotherapy comes the long-term complications. Like, it's
Yep.
not just you deal with the chemo. Oh, you got the chemo and you check. No, it's the repercussions are with you forever.
The repercussions are with you forever. And so I did all of those and I did something called immunotherapy. And so I did that for 6 months. And then I had a bilateral mastectomy and I did 6 weeks of radiation. And because when they did the mastectomy, they found that there was still some cancer remaining, I started another chemotherapy and more immunotherapy. And in that time, like you said, the disease is terrible, but the treatment is no walk in the park. So, I think related to the cancer treatment, I had a neutropenic sepsis and was hospitalized. I had a pulmonary embolism. There were a lot of things that happened along the way.
The sepsis, the neutropenic sepsis, was right after your treatment ended?
The neutropenic sepsis was during treatment, actually, because it was my neutrophils were really low because of the chemotherapy. And I got an infection and it just, spread really quickly. And I had to be hospitalized and put on, heavy duty antibiotics to stop that infection. And because I was so immune suppressed. And so they saved my life. And what I'll say is I was scared, but also maybe you know about this, Loriana. I'm guessing you do because you've been through it all. You know, you just put one foot in front of the other, too. Like you don't really have a lot of time to sort of think about it all and think like, this is traumatizing. You're just like, okay, now I have to gear up to face this next challenge. Now I have to do this thing. But when it stops, then it just really hit me, like, what did I just go, like, what just happened? And now what? And that's when I really felt like, oh, this is like, this is post-traumatic stress. And being an expert did not spare me. This is something that I had to navigate and continue to navigate.
Yeah. And I will say, I remember as you brought that up, when I went through leukemia. For the audience members who aren't aware of that, I went through leukemia. I was separated from my son for a whole year, and then 5 years to the day I had breast cancer. And I remember the nurse coming in before my 8 chemotherapies that I had and reading the side effects and telling me, and I'm thinking, look, I just want to live. Like, I don't even care what's on that paper. What choice do I have? Just give it to me. Now, so I didn't want to look, but now it's starting to rear its ugly head. So when you have the physical repercussions, the mental side, like the PTSD, and it doesn't mean, like, especially you're a trauma expert and you were not spared. I am a journalist and I was able to research, and I always preface it that I had privilege to get in with some of the best doctors, but I didn't have the mental health support that I needed. And it always made me ask, and I think when you and I talk, we say like, well, what about those who are underserved, who don't have access? If we're struggling and we have the tools we need.
Mm-hmm. That is so true. And that is, I think, why, what you're doing is really critical because, what you're doing in my field, we call it also, it's like, it's empowerment, but it's also sublimating. Like you're taking this really hard thing and you're making a difference in the world. You're like reaching out to others. Survivorship is about, recognizing the impact and giving it space and honoring it, right? Like not trying to pretend like nothing happened, but also finding ways, if you can, right, to sort of see like, I went through this. I'm kind of a badass. I did it,
Yeah.
And
Once in a while, I have to tell people that.
how can I
Like,
take
let me adjust my crown, because I have been through a lot, and I dare you to say I haven't. It's taken me a long time to be okay with that and not worry about what people think. And it's a process, because when this person called me crying about her husband saying, just get over it, I was just like, there are a lot of people, and I'm sure there's maybe friends I have or people I engage with in different capacities who are like, just stop talking about cancer. I'm like, this is my therapy. This is cathartic. This is how I handle it. And everybody has to have their own strategies. But I'd be interested to find out what kind of trauma, when you realized you had PTSD, because I remember my oncologist at Johns Hopkins saying, you have what we call post-traumatic stress disorder. You have PTSD and it's severe. And I kind of knew that, but like to hear him say it and see it in my chart, I was like, okay, so what do I do? So when was that moment when you realized like, okay, you've graduated, but now you're in survivorship? And then there's toxic positivity of be grateful. I'm like, oh, I'm grateful, people, but I still have the right to want more. So when did you notice that?
Yeah, no, absolutely. I mean, I think, what I said in the, you know, just a moment ago about that moment when treatment stopped. And I thought, like, now what? I think that was a real moment of realizing that just because it had stopped, I wasn't done. Actually, in some ways, I'd only begun. And in a way, I kind of knew that from my wife's experience. She kind of had the same experience. And I've heard now and learned that actually it's really common for people to get not only to have post traumatic symptoms after they finish treatment, but also to feel depressed, which seems so like incomprehensible. Like if you would talk to someone who hasn't been through this, it'd be like, why are you depressed? You should be so happy. Like you survived. And I'm like, yay, I'm not dead. But actually, I have been through hell and I don't know what this means. And it changed my life and it changed my perspective and it changed my body and it changed my relationships and my work and how I feel. And so, how do I make sense of what I've just been through and put my life back together again in some way, knowing that I'm not going to be the same person that I was? So, that was one sort of moment. And then I'd say the next thing is that, these symptoms just kind of come up and get you,
Mhm.
So like I would have experiences where, I'm generally I would like to think a pretty empathic person. Kind of drew me to the field
That's
and
why you're
became
in
a
the field. That's
better, right?
your job.
But like I remember this was before I was back to work full time, but someone was telling me their story of a surgery that was coming up and it wasn't cancer related and it was going to be a discreet thing, but she was scared and that makes sense. Like anyone going through surgery has every right to be scared. I get it. But in the moment as she was talking to me about it, and I told you about this earlier, Loriana, I found myself literally like taking steps backwards as she was talking. And I was like, what is happening to me? Because I was filled with these intense feelings of, like, if I'm really honest with you, it was like rage. Like, how can you be telling me about how you're so scared about this minor surgery, right? My brain and my heart tell me, of course she's scared. And I don't want to have that feeling and that reaction. But what I realized then was like, oh my gosh, that was a trigger. Like I just got really triggered by hearing about her fear. And it triggered this whole intense sort of feeling that I just hadn't expected or imagined. And I realized, like, oh, there's a lot here. And I'm really going to need to take care of myself and to think about how to care for myself to
Mhm.
process this so that I can move on, so that I can open up my heart to these different things and not have those strong reactions.
Yeah, and the thing is that you're an expert in this field, so you can identify that. And there's people who are feeling guilty for those thoughts but don't know how to process it. And
Hmm.
I know I've gotten frustrated if one person tells me, well, we could all get hit by a bus. Okay, good for you and your bus. And then somebody else, I have cognitive issues. I have a lot of memory problems, which sometimes get a little scary to me, which cause anxiety because I'm thinking, what else happened with all this chemo? So they'll say, well, I forget stuff all the time because we're getting older. And I'm like, I have to just like take a deep breath because I'm thinking, you have no idea. Like, you
Hmm.
don't have the cognitive issues. Maybe your hands are not on fire like mine are even right now. Your feet are not on fire. Your
Not.
body's not the same. And so I go through this list. And then I've had to also, because I'm such an empathetic person myself, and I had to say, you know what? You're allowed to feel pain and you're allowed to struggle too, but also acknowledge my pain and my
Hmm.
suffering.
Yep.
And so I want to go back to the conversation where you said when you acknowledge this, because this is very interesting dynamic that your wife had also been through it. So she at that time had been a patient and a caregiver, and then you had been a patient and caregiver. And what kind of light bulb moment that maybe you both didn't acknowledge to each other, because there is no secret that having breast cancer and having hormone therapy or having chemo impacts not just, well, it impacts your relationship from an intimate stand. Intimacy is greatly impacted that nobody talks about. We're going to have another webinar on that one. By the way, everyone, if you're listening, we have a great webinar coming up And this is how I think in my ADD fashion. Forgive me. We have a webinar coming up, and Dr. Kate couldn't make it on, so we thought we really need to talk to Dr. Kate. We have Armor for Life has partnered with breastcancer.org, and we're going to talk about all this long-term survivorship stress. So I'm glad we're having this conversation. And now I want to go back to the relationship issues, because so many people, my cancer has impacted my relationship. And I don't just mean just with my husband. I mean with relationships I have in everyday life. What did you both notice? Because you have that unique view, because both of you have been patient and caregiver.
Yeah, no, absolutely. Like, I think, at the time, I did not understand or appreciate, what it meant to face a life-threatening illness and to face your own mortality. Even though I loved her and was like wanting to be as supportive as possible, it isn't the same. To be on the side of someone is different. And, to face it yourself is a journey that is not really comprehensible till you've been there. And I would say for her, I think she did not fully appreciate like how hard it is to be on the side and to watch
As a
someone you love
caregiver.
go through that as a caregiver. Like, caregivers have a really hard journey as well. And it can be really lonely because all the attention is focused on the person who has, the cancer, which makes sense. But, if you're like also traumatized and terrified that this person you love is gonna die, or, watching them go through horrible, you know, experiences, or even sometimes through experiences that are really hard. Like if, so we didn't have hormone responsive cancer, but like, being on heavy duty steroids and being kind of manic and whatever, and it's really difficult. Like, I remember sort of like, oh my gosh, how am I supposed to navigate this? And then she was on the other side watching me on heavy duty steroids and like, hey, this is like not easy to sort of be in this space. So I think we were humbled and really appreciated that both sides of this journey are really profoundly hard to navigate. And I think we really gained an empathy. I think with relationships, it's true that, that sort of idea of cancer ghosting, that, some people will like, you'll lose some folks, like that happened.
I
You know,
used to, you know what I used to do when people would ghost me and I made them feel so uncomfortable? I would call them and be like, where are you? Where the hell have you been?
mhm.
And they would be like, and I feel bad because everyone processes things different. And finally, after putting enough people on the spot and making them feel bad, because I was in the hospital for an entire year with my leukemia, they finally said, I didn't know what to say. Like, I was so worried you were going to die because I knew the statistics and I didn't know what to say. But ghosting is real, and learning to share, it's not easy for everybody, but I encourage people, and if you're listening, if you're a survivor or a caregiver, to express how you feel, because you're not the only one. There are people everywhere who are having these emotions. And the fears, I want to address with you the fears of recurrence, because that we're going to touch on a lot in our webinar. I mean, how often, again, you deal with trauma, you have PTSD, you deal with PTSD. And how often do you have these fears of recurrence and scanxiety? And how do you make yourself feel okay about it?
Yeah, absolutely. So if I can, I want to answer that, but I
Oh,
want to say about
go
the,
ahead.
how do you sort of, your friend who sort of shared with you, I didn't know what to say. Like, I think that is the main reason that people, have distance. And, I always think like it is so important to get the message out there that you don't actually have to have an answer. You don't have to say a perfect thing. Being with someone and just saying, hey, I'm thinking about you and I'm calling to check in is good enough, right? And then listen and just be with the person. Like, there's no one thing that you're going to say that's going to make it all better anyways, right? So,
Like,
um,
you're strong.
yeah. In fact, sometimes when you try to say the right thing, it's almost harder for the person because there isn't a thing that you can say, right? Like you you just can be with your friend, you can be with your partner, you can be with the person and let them know that you are there with them. So I wanted to say that because I think a
Yeah,
lot
I
of
think
times
that's important.
we just don't get training in life people don't tell us that, they don't tell us, like, how are you with someone who's going through something so scary? So that's, I guess, one sort of thought. And now here's my sort of challenge. You asked me another question. Can you remind me what that question was?
Because my brain is all over the place today. This interview, because I have so much fun, I feel like it's harder when I know somebody well because I'm all over the place. Like, how much can we get in? I was talking about in our webinar, we're going to address with breast cancer survivors the scanxiety, that you're in and out of scans, the risk of recurrence, and people not understanding. Again, be grateful. And I for anyone listening who lost someone to breast cancer, we've all lost people to cancer. And
Yes.
I do not want anyone to think we are trying to diminish that loss and that pain and suffering you're feeling. But we do want to say is that while I am grateful I'm alive, I still have the right, and it took me a long time to accept that through therapy, to say I want more and I deserve more and I deserve a better quality of life. And I'm allowed to say I'm traumatized.
Mm-hmm.
So that being said, how have you navigated,
Mm-hmm.
especially going through as an expert, through your own fears of recurrence, your scans?
Mhm. Yeah. Thank you for saying that, because I always am very mindful of, wanting to say that my experience is just mine, and I don't actually want to diminish anyone else's journey. And there are people who have, as you said, have lost people very close to them. And, you know, I am sorry for that. And also, like, you have really had to journey to say, that I can both deeply appreciate being alive and also recognize that this was traumatizing. So, you're right. Oh my goodness. Survivorship and scanxiety and recurrence fears, like, it is huge. It's huge. I remember I went in, one time for a follow-up with my surgeon. She did an exam, she felt something, and I had reconstructions. I also went through, I didn't tell you that, but a deep reconstruction, which is a really involved
The
surgical
deep flap.
procedure. I did. The
I
deep
did too.
flap. Yeah, well, there you go. See?
Mine
And
didn't go so well, but
another way.
quick story.
It's another story. But,
Whew.
it's a big, for those who don't know, it is a very major surgery, a very major reconstruction process. Like, so, but I was thinking I did that so that I wouldn't have to worry so much about, like, having, repeat mammograms and things like that. Well, it didn't work out that way for me for a variety of reasons. I've had to continue to have sort of surveillance monitoring to make sure that there's no recurrence, and I've had to have biopsies. So it's been rough. And I will tell you, the first time when she sort of felt something and she said, let's get that imaged, and sent me back downstairs, as I was waiting for them to coordinate that, I started hyperventilating, and I was on the phone with my sister, and I was like, goodness, like, this is happening. And it just completely flooded me. And I was beyond anxious. I was terrified, and just bracing myself for that fear. And at least that time it was short lived, right? Like, I went and I got imaged, and then they did a biopsy in a short period of time. I also had a finding at one point of a nodule in my lung, and that nodule wasn't biopsyable, so they
Mhm.
couldn't test it, but they were concerned that it was a metastatic lung disease. And in triple negative, there's not a great prognosis for that. There's a pretty lousy prognosis. But they couldn't biopsy it, and they said, we'll just have to wait 3 months and do a repeat CT to see if it's changed. Those 3 months were maybe the worst of the whole journey, believe it or not.
Because you're picturing your world flipping upside down again.
I am. I was picturing it the whole time. And, I think it's very hard for people who haven't been there to understand the depth of the fear, the worry, the trauma, the anxiety that comes up in those moments, and how critical it is to just really, you know, help people feel like that is understandable, it's normal, and also find ways to cope, because we can't live our life on the edge, on the, or at least I'll speak for myself. I realized like I have got to like seriously practice what I preach because, I can't sustain this life on the edge all the time. I also can't totally eliminate the fear, but I've got to learn how to live with the fear. And, that's been the challenge.
I'd love to hear your strategies. For me,
Mhm.
I'm constantly, because of I had a blood cancer and breast cancer, I'm constantly in a machine under surveillance from the full body radiation. And when I get in there, first of all, even though I tell everyone to ask for help, the last time I didn't ask someone to drive me because my husband was out of town and I didn't want to be a burden. So I was crying, driving there the whole way. And then I have to say to myself in the machine, you are strong, you are brave, you are healed, you are cured. You are strong, you are brave, you are healed, you are cured. I have to come up with a mantra, especially that I couldn't take my anti-anxiety meds to get in the machine like I normally do when I have a ride. So
Mhm.
what are your
Yep.
strategies, even not just driving there, but leading up to it? How do you manage that?
Mm-hmm. Yeah, no, thank you for sharing also what you do. And I think the mantras and having something that you tell yourself that really helps to center you and to calm your nervous system is just an amazing thing. And I love what your mantra is. Like, that is so like empowering and restorative. And, I actually had a bracelet that I wore for a long time that said strong. Someone gave it to me. And then I realized I don't really feel strong. So I had a new one made and it says determined.
I like it.
And
I
it
feel like
was
mine
like,
just says here. I'm here, barely
well,
here.
there we go. I was like
We
determined.
should
I
have
was like,
bracelets that we can just change according to our mood.
there you
Wouldn't
go.
I would need a lot of because I have a lot of different moods after in this recovery.
Seriously. Yeah, but I like my determined, that was my word. I was like, I am determined to get through this. Like I am going to get through this. And so that mindset really helped me. But I do think taking care of ourselves is so critical. So I'll sort of share both personally and professionally. Like one of the first things I always say, and you mentioned something about this in what you just said is, get help, talk to your providers. Like we do not have to suffer unnecessarily. If you are struggling with depression, with anxiety, with, the impacts of post-traumatic stress, like there is help out there. There are therapies, there are meds, and there are other things that people can do that really are proven to help. And you do not need to be stronger than strong. Like just going through this is strong enough. And like getting the help that you need. So talk to your oncologist, your nurse practitioner, whoever it is in your clinic, your primary care doc. When you mentioned the meds that you usually took to be able to get into, like, yes, like
Yes.
do that for yourself, like do that for yourself.
Yeah.
And so I'm glad that you did that. Like, that's like a first thing, like tell people so that they can help you find the right help. That's
Right.
one.
And let the and communicate when you get there. I have no problem saying, listen, I am high strung, high anxiety. I need you to talk me through this scan and cheer me on. I told the last guy, cheer me on. I don't care if you don't think I'm doing well. Tell me I'm doing a great job.
Mhm.
And if you have to lie and say 6 more minutes when it's really 8 more, whatever you need to do, get out your pom poms, man, and cheer me on because I respond. We all respond well, one would think, to positive
That is
affirmations. So that's my strategy. But and leading into it though, it is hard because leading up to it, I do go through those moments of anger at the world. And I'm like, this is not who I am. But I feel like nobody around me understands and I'm on an island. And even my husband, who is great and he's been there for me and he's a wonderful caregiver, but I don't like to involve him because I don't want to be caregiver patient. I want to be husband and wife. So I get a little annoyed. I bite his head off, just with things because I don't want him to see me weak as I feel.
Mhm.
And then I'm trying to explain, you don't understand. So that whole conversation gets stressful of him saying, well, what do you mean I don't understand? So I think the communication has to go both ways and really sit down with your spouse and your caregiver and say, here's what I'm feeling and here's how you can support me. Because my husband's like, I don't know. I don't know what to say. And I'm like, well, you can say, you're amazing. Just your crown, lady. I said, but you could just say, I can't imagine what it's like to go through what you're going through.
Yes.
And I'm here for you, or just
Yep.
something.
Yep.
But don't tell
Exactly.
me it's gonna be clean, because you don't know.
Right. No
And
false assurance, right? Although maybe someone else might need something like that, right? Like everyone is also different. Like I don't pretend to speak for everyone about, what's going to work for whom. Everyone has to find their way. Um, but, you raise a different point, which is really finding people who you can talk with who get it. And, I sort of call that connecting with my people. That was like a really important thing for me. So I found that I needed my people, the circle of friends that I had, I needed it to grow to include other people who were going through some of the same things that I was going through. So I reached out, to people I knew who had been through cancer before, and I talked with them. I logged into breastcancer.org meetups and, talked to people who were going through similar experiences. And it was so powerful because I didn't have to explain to them, what it felt like. They understood. And when I said things, they didn't think like, oh, what's wrong with you? Aren't you just happy that treatment's done? They got it. They were there.
it's like a safe place.
Yeah.
And I know that's not, I don't know, it's maybe not healthy to only have that safe place and not have friends who haven't been affected by cancer, but you do feel very safe. Like
That's
you
right.
get them and they get you, and you're like, well, isn't this nice?
It
I feel
is.
heard and understood.
Yeah. And everyone's experience is different, like it's not that we all had the same things and we didn't all share the same experiences. And, maybe there are different feelings people have and it makes it easier or harder. But, find the people who you can talk to where you don't have to justify yourself, where you can just be. And sometimes if you can't, talk with people, I'll tell you, listening to podcasts is powerful. I did that. And it was another way that I felt connected to my people because I would listen to, women talking about breast cancer. And I was like, oh my goodness, like that's me. I totally get that. Like,
Like this
like,
one, listen
these
to
are
all of
my
our stage
people.
free. We have a lot of great stage free podcasts, and we are your people. So we would love for you to listen to some of the other episodes we have. But it is true. And again, this podcast is also for caregivers, because to understand. And for the caregivers or for anybody else listening, you never know when my story or your story could be your
Mhm.
story.
That's
And
right.
so you never know when your world could flip upside down, and just knowledge is power. I wanted to know if you have some strategies, having been both the caregiver and the patient. What are strategies you have for the fears of recurrence and the scanxiety and
Yep.
the body image? I mean, body image is also hard on marriages and relationships,
Mhm.
and just your overall happiness. I know, we both went through the deep flap. Some days I look in the mirror and I'm like, who are you? I mean, I don't even have my own DNA after my transplant from leukemia. So I'm just like, I don't know who the hell you are, but it's just, it go mentally, that trauma can take a toll on you. And how do you work on that dialogue with your spouse or your friends?
Yeah. Well, I would say, first of all, it is so normal to be going through all that. And I do try to remind myself of those things because I have the same feelings that you're talking about. Again, no shortcut just because I'm a psychologist, like I have to think about, wow, like my whole life completely changed. My body changed, it affects relationships, so really, just acknowledging that that's happening is really important. And then, I think that getting support and help, if that is something that you are interested in doing, having a place to talk with someone who can understand and support you in going through those things. Maybe the cancer center that you're getting treatment has some folks who understand cancer that can provide some short-term therapy. Something like that can be incredibly helpful because it's new for you, but these are not new or surprising reactions. Like this is really typical. And the things that, are sometimes considered most taboo, like in therapy, we always say like the hardest things for people to talk about are often like, money and sex, right? And like, so body image and intimacy and financial strain and all of those things, like those are things that are really normal things that people struggle with and go through in the course of cancer treatment and
Yeah.
survivorship. And so, find support for those things and know that you're not alone.
That's what I say. No, you're not alone, that what you're feeling, what you're going through, whether, I was talking at a conference and explaining what we're going through. It's not just that we had cancer, which is never just a just. It's all the dominoes that fall after that. The financial stress that puts on a relationship and a marriage, the pressure to get back to work or to earn an income. I used to say, do I make resumes in case I live or memories in case I die? Like, what do I do? Because I lost so much time with my son. And how do I communicate this? So I really encourage anybody who's listening to ask for help. Now, I get it. My husband and I tried to find a trauma expert, Dr. Kate, and they were saying, oh, it's like $225 a week and you should go 4 weeks. I'm like, I can't afford it. You know what I'm going to do? I'm going to spend my $115 on yoga and say my prayer and do my breathing technique of breathing in 4 seconds, holding it for 7 and breathing out for 8, because I can't afford it. But I have learned from other podcasts and listening to other experts about communicating. And I was sharing with you on our call that when we spoke earlier, is that I felt so validated recently. And I was just coming off the stage from speaking, and an oncologist, a hematologist who works in the blood cancer space, came up to me, because I get nervous when they introduce me and they're like, it's almost like, we can't believe she's alive. And she found me and she's like, listen, I want you to know you don't have to say that you're like crazy. These are not crazy thoughts that you're having. These are realistic thoughts, and you have every right. Like, you could have a recurrence. This is realistic. So don't let someone tell you that these thoughts are crazy or get them out of your head or move past the cancer. What you're feeling is real. It's rational. It could be a reality. And so that made me, it like validated me.
Yes, 100%. And, it is so important. I'm so glad that that person could share that with you and really validate your experience. And, and in turn, you're validating it for other folks. And that is part of what I see as my mission as well, to really let people know this isn't crazy. This is an understandable reaction to a crazy circumstance, right? Like
I love
and
it.
there's a big difference there. So, that said, sometimes you really do just have to, take a moment and think, I'm having this major reaction. I have to calm my nervous system myself. This is something I need to do. So I love that you found yoga. That is, for many people, incredibly healing. That kind of body-based work where you learn how to really calm and soothe your, body in the face of a fight or flight trauma response. And so some of the things you asked me earlier, like, what do I do when I'm having a, you know, scan and I'm feeling super anxious? Like, I absolutely do the breathing. You do the 4-7-8 breathing you sort of described, and that is awesome, where you just sort of breathe in for 4, and I can, and hold it for 7, and then a long, slow exhale for 8, and count that sort of over and over again in your head, just breathing in for 4, holding for 7, exhaling for 8. And the reason that works is that when we are in a highly stressful situation, a traumatizing situation, our body goes into fight or flight. Heart starts to race, our palms get sweaty, all these things happen. And when our body is reacting like that, it tells our brain, you're in danger.
Mm-hmm.
And what we can do is we can actually change how our body is responding by slowing our breathing, taking deep belly breaths, calming our nervous system. And what happens is our body says, hey, you know what? You're safe. You're okay. And so it's this back and forth between our mind and our body that is so important. And so taking the time to really find the things that help you to sort of calm and to soothe, and they can be as simple but as powerful as breathing.
And I
Is
do want
that
to add, we
cool?
have another episode on Stage Free, because I've done a lot of research. I'm now doing a guest lecturer at Rice for Understanding Cancer at Rice University, which is just an honor. And one of the things they're studying is the connection between, which we all know now, stress and cancer connection. And they're looking at the impact of therapeutic yoga, saying, how can we reduce the risk of recurrence? And that's the topic of our webinar. So one way they're saying we can reduce the risk is by reducing our stress levels, but we're stressed after cancer. So we have to find like yoga or breathing to reduce the stress, to reduce the levels of cortisol so we can reduce the inflammation, because stress causes inflammation. Inflammation is a fertilizer for cancer. So to everyone I tell who's listening, when someone gets me stressed out or at normal, whoever it is, my family even knows, I go, oh no, I am not going to participate. I'm going to protect my peace and my happiness. I cannot have more inflammation. You won. I mean, I don't have time to argue anymore, because my doctor always tells me, my oncologist, you know, that Scott's fertilizer can tells me, like, every time someone's stressing out, think you're just fertilizing the inflammation. I've never got that out of my head. So now when someone is upsetting me, then I just say, talk to the hand, because I cannot engage. Like, it's not worth me winning this argument or winning anything, because if I want to win at life, I have to back off this conversation.
Yep, absolutely. Good for you for putting yourself first in that way. And, and I know that you know this, but I'm going to say it for others in case they feel it. Like, just because something, like stress can be fertilizer for cancer, it doesn't mean that you are responsible for the fact that you got cancer. Does
Right.
that make sense?
Right.
That feels really important to me to always say, because, there are a lot of reasons that we get cancer and it's not our fault.
You're not carrying that guilt around.
That's right. But we can take care of ourselves, and we can do the things that we can do to really both feel better, right? Because it doesn't feel good to be in stress. And yeah, those things can help. But, it's not our fault. And so we have to put ourselves first at those moments and care for ourselves in the way that works. And also, give ourselves grace for the fact that also sometimes doing all those things is hard. Like, exercise is great. Well, sometimes it's easier to exercise. Sometimes it's harder to exercise, right? So,
yes.
I think
make time for yourself, prioritize your peace and your happiness, and remember that you are not at fault, but to communicate.
That's right.
Is there, you and I could talk, we could just do hours on a webinar. We'll have to have you back. Is there anything else you want to add before we go, just talking about any messages to patients, to survivors?
So to my sisters and, the folks who are out there living this and their partners, and, is that it's not as simple as, oh, it just all gets better. We have to actually walk this walk. We have to be, kind to ourselves and care for ourselves. And, there's hope for healing. That, we do also have the potential to heal. It doesn't mean that it all goes away. We live with this. It changes our worldview. We know what it is to go through this. There's a kind of naivete that we don't have the privilege of having anymore. And yet healing is also possible. So, find the things that help you to heal. Is it writing? Is it walking? Is it connecting with your people? Is it doing yoga? Is it listening to podcasts? And give yourself grace. The, post-traumatic stress and anxiety and depression, understandable reactions to a very, unreasonable experience. We are all strong by the nature of we have to do this. But, wear that crown with pride, because, survivorship is not for the faint at heart. We are a strong people.
Yes, absolutely. I couldn't have said it better. And I love the way you just rounded this all out. And I wish you could be on the webinar, but I get to talk to you even longer on the podcast. And we have to have you back, because there are so many other angles we need to address. So we will have you back. So thank you, Dr. Kate, for being on and for sharing your insight and your wisdom and your experience as both patient, caregiver, psychiatrist as well, therapist,
Just
I'm an expert. You're everything. And so I just want to say, no matter our expertise and our background, survivorship is a journey. It's a process that you have to go through. And no one should do it alone. And it's okay. And it's quite normal, like you said, to feel these fears and emotions and find ways to communicate. And for our listeners, don't forget, January, you can register for free. It's a free webinar. Armor Up for Life is partnered with breastcancer.org. Dr. Kate also takes part in these meetups, in the support group meetups. We're going to dive deeper into the mind and body struggles post-cancer and give you actionable tools to thrive. So thank you for listening to Stage Free, where our mission is to help you master survival for you, the patient and the caregiver, and everyone involved on your care team. Thank you, Dr. Kate.
Thank you so much for all you do and for having me here.
Learn more about Stage Free and catch up on previous episodes at armorupforlife.org.